the panel here to the Art Therapy for Dementia event, which is organised by Multicultural Arts and Media Centre in collaboration with community organisations, and it's supported by Greater Manchester, Lancashire and South Cumbria Clinical Networks and Senate, Clinical Commissioning Group, Haywood, Milton and Rochdale, Social Investment Fund and Link for Life, who are committed to engaging with patients, carers and members of the public in promoting awareness of dementia and mental health well-being. Briefly, as an organisation, we provide services to young people, unemployed and the elders through arts and media activities, accredited courses, work placements and work club to all communities of the borough and the Northwest.
We've got at least 2 or 3 projects with Mind, etc, so we're very excited about that work. Because as I said before, we believe in this grassroots development. We believe in people becoming resilient together, learn together. Some of the stuff that Grace talked about Dementia Friends, is right down our street from our strategic approach in the CCG. So all this work is something that we really believe in and want to progress going forward. Getting back to dementia, we're opening what is the very first unit in the Northwest. We've done a huge amount of research about dementia and medicine. We've got a very strong belief in the governing body board in the CCG that we use a test, and the test is, what would I want my grandmother to look like? What would I want the service my grandmother would need and deserve?
So thank you for organising this. But on a serious note, one of the reasons why I'm really pleased that we're having this date here today, because dementia in the Asian community and the BME community, when we use terms like BME, Black Minority Ethnic, I also include in the Black Asians. I also include in that African Caribbeans, I also include in that faith groups like Muslims, Sikhs and Hindus. So the Black is more of like a political term in a sense where people will have from different groups very similar experiences. So in this case, in this instance, I'm using the word BME because A, it is acceptable and recognized nationally by professionals, but it doesn't mean it's the right terminology. And I can understand that from certain people when they have that. So I just wanted to say that at the outset, really. So what I'm going to do in the next 10 minutes is to just give you a bit of a snapshot of the Strategic Clinical Network and the NHS England and some of the key players there, and then go into a bit more of the issues facing BME communities, the issues that's facing you and people in this room, basically, in a sense on it. And the reason why I'm going to do that is because it's important for us to have the facts and the figures, in a sense, from that side. So, in a sense, I hope that makes sense. I won't go into bilingual all the time because otherwise it'll take around about half an hour. My apologies. But if anybody wants to see me afterwards, if they don't understand what I've been saying, then I'm happy to sort of go through with that because I'll be staying all the way through, really, in a sense, at break time or after the session itself. So who is the Strategic Clinical Network? These are some of my colleagues, the senior managers and senior people, in a sense, with regards to who actually runs the Strategic Clinical Networks and Senates. And the beauty about the new way of working is that as a manager, as a senior manager, as a strategic manager, we can no longer just work on our own. We have to work with clinical leads, the doctors, the GPs, the medical doctors, the clinicians, as we call them in one sense. So it's a great partnership of the two coming together, basically, or three-way partnership in one sense, if I can extend that. So we have a clinical leadership that leads the Strategic Clinical Networks. The reason why they lead is because they know more about the medical clinicians and clinical areas than myself do with regards to that. But they do need our strategic policy development experience to make things happen. So that was the thinking behind setting up the Strategic Clinical Networks. But then there's another element to that, and that element is the patient and the carers and members of the public, which is the heart of the two clinical leads and the strategic sort of direction which we provide. Without the patient and the carers, we can't really move on some of the and tackle some of the areas of work that we want to do, like dementia, mental health, neurological conditions, cancer, and other areas. So these are some of the drivers, basically, of the Strategic Clinical Network. You see Janet Ratcliffe there, who's the Associate Director, Peter Elton, who's the Clinical Director for us, and Donald Donoghue on the Senate sort of chair, he's been recently been appointed. Dr. Raj Patel, the Medical Director, and Jim Gardner and Mike Prentice, also Medical Directors. The Strategic Clinical Networks and Senate area as a footprint, as we say, It's Greater Manchester, Lancashire and South Cumbria. So we have a wide sort of a region that we're responsible for, and not just Greater Manchester, although we're based in Greater Manchester, but our area, our footprint as we call it, is much wider. So we want to do something like this in Lancashire and Cumbria and so forth, hopefully in future as well. But these are some of the key players. So what do? We link ourselves, our work of mental health, dementia, cancer and cardiovascular and the others, as you can see in that block there, with domains. And the domains are set by the NHS England. There are 5 domains altogether. The first 3 domains are, domain 1 is preventing people from dying prematurely. The second one is enhancing quality of life of people with long-term conditions and helping people to live longer. Those are the 3 main domains. That's a national priority from England, in NHS England. And how we do those is in the areas is cardiovascular, mental health, and dementia, why you're here today, is one of the areas which we are taking forward. And then there are also cross-cutting themes like patient safety, which is a domain 5, and patient engagement. People like yourself and public engagements, very important for us to do that. And those are cross-cutting themes in the areas of our work. We also have palliative care end of life, which are very much linked to cancer and dementia and other conditions in one sense. So that's another priority that we have as a strategic clinical network. And on palliative care end of life, Kim Wrigley, she actually leads on that. She's the champion within the strategic clinical network for the whole region in one sense from that side. And she's done some fantastic work around there, trying to cascade that down and thread it into all the other areas of work. So that's very quick snapshot. Who's the leaders are, what the work we do. So today, sort of dementia friends and dementia champions and the work we're doing on dementia, you are actually helping us to meet some of our outcomes, some of our objectives that we have to set. It plays an important part in us reporting that back to the national. So our aim, basically, the Strategic Clinical Network, is to improve quality, improve health outcomes on long-term conditions. So जो हमारा aim है ना जो organisation का वो है कि to tackle long-term conditions जो बीमारियां हैं हमारे पास.
But what is a dementia-friendly community? I've added a definition onto the slide, but just to say out, a dementia-friendly community is a community where people with dementia feel understood, respected and supported to live independent and fulfilled lives. What does that actually mean? It means people with dementia are listened to. The community is shaped by their views. We've already heard that there are issues in terms of getting referrals from GPs. We need to listen and take action on that. We need to empower people with dementia so that they feel that if they've got an issue, they can bring it up and they will be listened to. This is what Dementia Friends is trying to address. These negative terms are generally what the whole society perceives dementia to be about.
कोशिश करें कि ये जो आपने शनाख्त की है, जो डिमेंशिया फ्रेंड्स है, वो जो दोस्ताना माहौल है, ये उसको पैदा करना चाहते हैं.
I've really enjoyed the session so far. It's made me very aware of why we all need to be made more aware of dementia, and the fact that people in the BME groups are not being assessed and treated as they should be, which was why it was good to see so many of the ethnic minority women here, and the fact that the session was being translated will be very helpful to them.
My name's Chanel Anwar. I found it very informative. It was really interesting, especially that it was in English and in Urdu, obviously for the Asian community. And I think we need a lot of organisations like this so that it helps a lot of people, especially the Asian community who don't go out and about.
So this program today has been really good from my perception, coming here, seeing such a collection of different people from different backgrounds, both professionals and service users and all walks of life.
The community need to be aware of dementia, and it's very, very, very good. I think lots of people will gain lots of confidence coming out and speak, and it's really, really good.
Whereas I think this afternoon, we've all been challenged a bit, haven't we, to learn. The bingo gets you going a bit because you think, oh, I really want to get this right, that sense of competition. And at the same time, we're learning. So I hope that for everybody that we can take something away from this today. I certainly have learned a number of things that I can take away, but we can translate that into some actions. A few key words that have kind of come out through the afternoon. First of all, I think it may have been Sawa, maybe Maksud, I can't just recall, but collectively looking forward. And I think again that's really important because we can do great things together. You know, if you think about the number of things that have happened because people have worked jointly, they've worked together, they've got over those differences, and they've all been respected as individuals coming together to make a difference. I think that's really important. That we're in it for the long term, that as the strategic clinical networks that Maksud and myself represent today, that it's not just a one-off. Or do you remember that day 5 years ago that Maksud and Kim came? Well, what happened to them? Where did they go? And that's something that we've got to change, I think, in the NHS and in the public sector. People appear, they say great things, but then they fizzles out, they go away, we don't hear about them again. So we've got to make sure that that doesn't happen. I think this is a starting point. Clearly, Sawa, you've done some fantastic work with your team and the people that represent the borough already. So it's a starting point from the dementia perspective rather than all the other wonderful things that you do. And it's building on that because it's a great opportunity in terms of the arts and the media and the cultural opportunities. And clearly you've got some sign up for that today, so that's great. I just want to finish really with 9 statements. They're called the I statements. And these statements were written by the Department of Health on the back of the National Dementia Strategy. And the vision was that by 2014, that anybody living with dementia would be able to confidently say these 9 statements. So I don't think we're actually quite there yet. We're in 2014. But I think for me, it really personalises it. And at the end of the day, you know, there will be people here that are affected by dementia. If you're not now, you will be in the future. We've had it in our family. The chances are it may occur again. So again, it's kind of bringing it back to our personal circumstances. This isn't something that you can say, well, it's not going to happen to me or my family, because actually there's a very high chance that it will do.
Dementia Friends is a national initiative and it's all about raising awareness amongst the general public. In the next hour, I'm not going to turn you into experts about dementia. What I am going to do is tell you 5 key messages that we feel everybody should know about, so that we're challenging that stigma and raising understanding and respect for people with dementia in our community. With the right understanding and awareness, people can live well with dementia, and we can contribute to people if they develop a diagnosis or a loved one gets a diagnosis. They don't automatically feel terrified and think of all these terms. Right, so I'll just ask you to take a case study from this box. It's really important that you keep that case study a secret. I'd like you to still keep it a secret, but imagine you are that person. I'm going to read out statements and I'd like you to take a small step forwards if you agree with the statement. If you don't agree, just stay where you are. You can make cheese on toast on your own. Not sure. And finally, you are able to complete crossword puzzles. So you've all answered those statements, imagining you're the person on each of your case studies, and you've all made different decisions on how much you can do. Can I ask you to read out your case study, please?
I'm a 73-year-old lady. I've been diagnosed with Alzheimer's disease 6 years ago. I live with my husband in my family home.
And I think a few phrases and words I've heard today have been along the lines of working together, making a difference, sharing ideas, and actually valuing each other as a member of our community, which ultimately is what today has been about.